Good morning, Adam. I am Dr. O'Keefe's clinical nurse, and I'm going to do an assessment of your circulatory system, your heart, and your blood vessels, and then I'll report my findings back to him, and then he will come in and examine you.
Okay.
How are you today?
All right.
All right. Okay. I need to ask you a little bit of family history. First off, do you or anyone in your family have hypertension or high blood pressure?
My mother has some high blood pressure.
Anybody have a pacemaker?
No.
Anybody ever had a cardiac catheterization?
No.
Do you know of anyone that has congestive heart failure?
No.
About diabetes?
My mother and grandfather.
Do you ever get short of breath with mild or moderate activity, Adam?
No.
How about feel chest pain or experience heart palpitations where you feel like your heart's pounding fast?
No.
No. Are you on any cardiac medications, blood pressure medications?
No.
That's good. How old are you?
29.
Do you smoke?
Yes.
Okay, that would be a good idea to stop. You'll probably be on some cardiac medications before too long because it really affects the circulatory system and the blood vessels. You've heard of coronary artery disease. It increases
Yes,
the
I
risk
do
of
need
that.
to get the habit kicked.
Okay. Exercising daily and eating right are also important. All right, I'm going to inspect and palpate your chest. And when I say inspect, I'm just going to look. And when I say palpate, I'm going to feel your chest. Okay?
Okay.
Okay, I don't see any visible pulsations, which could mean you had a thrill, which is a palpable murmur. A palpable murmur, excuse me. Now I'm going to feel. Okay, if you could sit up, I'm going to do the same thing. And if you could lean forward. Okay, you can go ahead and relax. I don't feel any heaves or lifts. Let's see if I can feel your apical pulse. It should be located here. Also called the point of maximum impulse. And I'm going to palpate your carotid at the same time. And the pulsations should match. And they do. That's good. Okay, I'm sure you've heard of the chest x-ray. A lot of times they use that to check the lungs. They also use that to check heart size. Now, if someone's examining you out of necessity and there is no radiographic facility available, the examiner may percuss the heart. What I mean by that is tap on the body. And a good cardiologist or practitioner can tell when the sound changes from resonant to dull. And they would mark that as the cardiac disorders and then measure to get an estimated size of the heart. Okay, now I'm going to auscultate. What I mean by auscultate the heart is to listen. I'm going to use a stethoscope, which magnifies the sounds I'm going to hear.
Okay.
When I do this, I'm checking your rate, which normal rate is 60 to 100 beats per minute. Your rhythm, see if it's regular or irregular. And then when you breathe in, I'm going to listen to see if there is a splitting. Okay?
Okay.
Take a deep breath in. Okay. I hear lub dub, lub dub. And the lub dub LUB stands for S1 or systole. DUB stands for S2 or diastole. And there are S3 and S4 heart sounds. Usually they are not heard. If they are, it is usually a sign of the disease process. I did not hear any. Let me see one more time. Okay, take a breath in, breathe out, and then hold it. Okay. Rhythm sounds equal. It is between 60 and 100 beats per minute, which is normal. I don't hear any murmurs, which is prolonged or extra sounds, which can be a sign of obstructive blood flow. I don't hear any grating or rubbing, which can be a sign of inflammation of the pericardium. If I did hear a murmur, I should be documenting the time, the duration, the pitch, and the intensity and location. So Dr. Keeve could check this symptom out further and see if there's any disease process going on there. Okay, I'm also going to listen to your heart again, and I'm going to listen in 4 different areas. And you have 4 different valves in the heart. The pulmonic valve, the mitral valve, the tricuspid valve, and the aortic valve. And I'm going to listen in all those areas.
Okay.
I'm going to listen with both sides of the slits here. If you can roll to your left just a little, listen to those again. And with the diaphragm. And if you could sit up and let me listen to those areas one more time. And with the bell. Okay, Adam, your rate sounds even, your rhythm sounds good. I hear no murmurs, no cracks, no rubs, no thrills. If you would have any cardiac problems, your practitioner can order numerous tests. One could be an echocardiogram, which is a test that tests the strength and function of your heart. EKGs are often done. They check the rhythm, the rate. Everyone wants to have normal sinus rhythm, but sometimes you'll have a bradycardia, which is the heart beating too slow, tachycardia, the heart beating too fast. You might have a 1st degree or 2nd degree heart block. The sinus rhythm monitors help the doctors diagnose different electrolyte imbalances, which can affect your cardiovascular system. We're going to move on to the blood vessels now. Do you or any of your family, have you ever been told that you have peripheral vascular disease?
No.
Good. Okay. I'm going to look at your skin here. Looks good in color. Vessels look even, symmetrical. I don't see any rashes. Normal hair growth. If you had peripheral vascular disease, you would have a loss of hair on your shins, and the skin would look really shiny and taut there. Yours looks normal. I'm going to check your pulses and some of your lymph nodes in your arms and legs. What I'm checking for is the rate, which is normal, like the heartbeat, 60 to 100. I'm checking to see if your rhythm is regular or irregular. And we'll go ahead and I'll check your apical pulse first. We'll compare it with your carotid artery. And they are equal or working simultaneously. Now I'm going to check your radial pulses on each hand, which are the pulses next to the thumbs. And they are the same. The ulnar pulses, which are the pulses next to the pinkies, they are the same. Now let's feel for your brachial pulses. Very good. And we'll check your lymph nodes there and here. No swelling. Any tender areas there?
No.
Okay. All right. Pulses are graded by numbers. 4 is a bounding pulse. 3 is a full or increased pulse. Practitioners document a normal or expected pulse as a 2. If you can barely find a pulse, it's weak. And if there's no pulse, of course, it'd be a 0, it'd be absent. All right, what we're going to do now is take a look at your hands. People with pulmonary or cardiac disease often have clubbing of the fingernails, which is the fingernails curving down. Yours look nice and straight. The angle's good. I'm going to check your capillary refill, where your nail beds turn white, and when I let off, they pink up in less than 2 seconds. Let's check this in. Very good. Okay. Next, we're going to do what they call an Allen's test. I'm going to press on both pulses. I want you to squeeze your fist and open it 5 times. And leave it open, relax. It's got a white powder color. When I let off the ulnar, it pinks up right away. Very good. Let's check this again. There. Okay. It pinks up really nice. Okay. Next, we're going to put your legs up in the air. What we would do, we would hold these up for 60 seconds, and the color would be like a mild pallor. And then we would put your legs down. Go ahead and put them down. And we'd let them dangle in a position down to the floor. And the color should come back to your legs in 10 to 15 seconds. Now I need to check your femoral pulses and your femoral nodes. You have femoral pulse right in here. Okay. You have 2 groups of inguinal lymph nodes. Have you noticed any swelling?
No.
Okay, check the other pulse. Very good. I didn't feel any abnormal or swollen nodes. How about your popliteal pulses? Let's check them next. Very good. Yours are what's expected. A 2, maybe a little bit more, a 3. Nice and strong, equal and regular. Now I'm going to check your muscles here. Do you have any tender areas?
No.
No. Okay, I'm going to feel your skin warmth of your arms and legs if you put your arm back down. What I'm looking for is to make sure there's no cool areas or warm spots. Your circulation is equal, symmetrical, and it feels that way. Let's see, let's check your pedal pulses, which are on top of the foot. Both are good. And your posterior tibial. Scoot back so they can see my assessment better. You bend your feet up a little. Good. Okay. Now let's take one knee at a time. Bend it just a little right there. And we're going to dorsiflex the foot. Do you have any pain in your calf?
No.
Okay, that's called a negative Holman sign. Let's try the other one. When you have a positive Holman sign, it's often a sign of a blood clot. Okay?
Okay.
All right. Now I'm going to check for edema. What I mean by edema is swelling. And you press on a person's skin. People often get edema in the hands and feet or thighs. And when you let off of it, there should be no indentation. If there is an indentation of 2 mm's, it's +1, pitting edema. 4 mm's would be +2, pitting edema. 8 mm's would be +3, pitting edema. Or your +1 fingertip marks will disappear quickly. The +4 can actually last 2 to 5 minutes. And with some diseases of the liver, people can have edema clear up to their thighs and edema in their stomach, which is called ascites. So hopefully we'll never experience anything like that in our lifetimes, you or I, either one, because that is chronic disease. Okay, Adam, do you have any varicose veins that are sticking out or discolored or bubbled up?
No.
No, I don't see any. It's good. Okay. We're almost through the assessment. Okay. I'm going to check for some breweries. And what I mean by that is I'm going to listen with my stethoscope, and I'm going to listen with the bell of the stethoscope, or the small side of it. And I'm going to see if I hear any swishing sounds. I'm going to check your carotid artery.
Okay.
Okay. Your abdominal artery. And of course, a good cardiologist would also check the renal artery, iliac artery, and femoral artery. I felt I heard no breweries when I was listening, so that is good. That would be an abnormal finding. Next, I would like to have you turn your head slightly to the left, and I'm going to look just below the sternocleidomastoid muscle and at the supraclavicular fossa, and see if I can see the jugular vein pulsating, which I can. Okay, I'm going to measure that. How we do that, I'm going to put a ruler right here at the apical chest, and then I'm going to put one at the top of the pulsation, and your measurement should be less than 9, and yours is. Okay, Adam, I have no abnormal findings to report. One other test I wanted to do, let me look at that jugular vein again, and when I press on your stomach, the pulsation will rise, and when I let off, it will go down. Okay, I want to thank you, and make yourself comfortable, and I'll let Dr. Keith know you're ready, and he'll be in to examine you.
Okay, thank you.
Have a nice day.
You too.